Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 27th, 2025. This video is on a Lancet article published online on May 21st titled Safety and Efficacy of Low Intensity versus Standard Monitoring following IV thrombolytic therapy in patients with acute ischemic stroke, the OPTIMISTmain, an international pragmatic stepped wedge cluster randomized control non-inferiority trial. Thrombolysis monitoring protocols stem from 1990s era studies. High-frequency checks disrupt sleep, burden nurses, and may be excessive in low-risk stroke cases. So this trial, the OPTIMISTmain asks, can low-intensity monitoring be just as safe? 114 hospitals across 8 countries, 4,922 adults with mild to moderate stroke, NIHSS score less than 10, treated with IV thrombolysis were included. This was a stepped wedge, cluster randomized, blinded endpoint non-inferiority trial. In the standard group, 37 assessments were made in 24 hours. In the low intensity, 17 assessments were made in the same time period. Primary outcome, modified Rankin score of 2 to 6 at 90 days. Non-inferiority margin, 1.15. Key findings and takeaways. Modified Rankin score 2 to 6 at 90 days. In the low intensity group was 31.7%, and in the standard group 30.9%. The P for non-inferiority was 0.057. Symptomatic intracranial hemorrhage in the low intensity group 0.2% versus 0.4% in the standard group. There were no meaningful difference in sleep, quality of life, or adverse events. ICU admissions were lower with low intensity monitoring, especially in the US, 47% versus 77%. Weak but consistent evidence of non-inferiority. Implementation feasible outside ICUs. Frees nurses time for education and care. Hospitals may cautiously adopt low-intensity protocols for select low-risk patients. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.